Well, Brenda, thanks for coming in to share your story of how you managed your cancer. I heard your introduction there. You are somebody who's been diagnosed with an esophageal cancer. Is it okay to ask you about how that came about?
Yes,
from the
yes,
start?
that's fine.
How did you discover that diagnosis?
In the autumn before I was diagnosed in, I think it was the February of the next year, I went to my GP with recurrent indigestion and heartburn. All the various treatments that he gave me seemed not to touch it, at which point he scared me nearly witless by telling me I was the right age for stomach cancer, and he would send me off for an endoscopy, which he duly did. They discovered a polyp, which, using that word, didn't frighten me in any way at that point. Had they said perhaps growth or something, I might have been a little more aware of what was going on. And it came back that there was a very early stage cancer in the esophagus, and I would need major surgery.
So that was definitely, a piece of information that, wasn't welcome, a shock, if you like, to the system. Do you feel that they gave you enough information then for you to know that they could do something about it?
At the point at which I was told it was cancer, yes.
Yeah.
I got a really good feedback on what the operation would consist of, that because it was early stage, I wouldn't need any other therapies, for which I was immensely grateful, that it would be surgery for most of a day. There were 2 surgeons on it. I spoke to the anaesthetist and he explained the process there and the various risks of it. And yes, I felt that I was as well informed as I could be on that.
And what was the next step then for you?
Right, after the diagnosis, it was really just to get admitted into the hospital and then go through the process of the surgery.
So you went into hospital then, and you we're getting ready for the surgery. It's quite a big operation in many cases, isn't it?
Yes, it's major.
And can you describe for the viewers what it involved in principle?
Because I'd had a thyroidectomy a number of years earlier, they couldn't operate in the way that they would normally operate for an esophageal cancer. So they had to do an Ivor-Lewis, I think that's the name of it, operation, which involved a cut down the middle and then a cut around the side and remove part of the rib and put everything back together again.
How long was that operation?
5 hours.
Yes. And I know from previous experience, patients who have that Ivor-Lewis procedure sometimes go direct to ITU.
Yes,
to
I
make
was
sure
in intensive care. I live with my sister and obviously she was supporting me along the way. I think I was in there for 3 days in intensive care, 2 days or 3 days. I know I told her not to come and see me because I didn't think there was any point when I was going to be fast asleep. But when I woke up, she was there, which was nice. Then I went from intensive care to a high dependency ward, and I was on that for the most of the rest of my stay in hospital. I think there was only the day before I was released that I went on to a lower dependency ward.
Really? And how long was it until you were discharged from hospital?
I think it was 10 days, something like that.
So you had quite an extensive recovery period in hospital.
Yes.
And then at the point of discharge, how much back to your normal self were you?
Oh, I should say probably less than 60%.
Really?
Yeah. They'd obviously had to put an awful lot of fluid into me while the operation was going on, and my legs had swollen to a huge size, and I was really quite perturbed, but I was told that would go, and it did. So yeah, I would say I was definitely well under par, possibly even only half my normal sort of self. Decision making is one of the things I think that I've found quite hard with this